This Ontario abortion clinic manager is speaking publicly for the first time.
I was absolutely disgusted when I heard what had happened in the U.S.
And he says it's time for Canadians to talk about our own abortion access.
I would love for us to take steps forward in making sure that these services are protected and women will always have access to them.
Global News agreed not to reveal Omar's last name or where he works.
I've had friends that live in the U.S. call me immediately after they heard what had happened, and they were begging me to give them options. They were telling me, they're like, please, what should I do if I become pregnant? Can I come to Canada?
4, 6, 8, you can make us procreate!
Unlike in some U.S. states, there are no laws in Canada banning abortions, but equal access to abortion services is not guaranteed. A Global News investigation in Ontario found abortion centers that are suffering from financial neglect, some struggling to stay afloat in a system where not all providers are treated equally. In the early 1990s, Ontario began funding the overhead of a select few independent surgical abortion clinics. This improved access and increased medical safety. But since then, 4 more similar clinics have opened, and they receive no such support from the province. Omar's is one of them.
I don't really understand or know how they've come to the conclusion that these 4 clinics deserve funding while other clinics don't.
Abortions are covered in Ontario, with the province reimbursing doctors for insured care. But Omar says that money is not enough to cover all of the expenses needed to keep his clinic going.
We have to pay for medication out of pocket. We do pay for rent. We also do pay the salary of all the nurses and counselors and secretaries that we have working for us.
On top of this, there are services his clinic offers that Ontario doesn't cover, including running a 24-hour patient hotline. So to maintain these services, he relies on his patients to pay a fee, but only if they can.
A lot of times we'd actually rather see it as a donation. With the specific demographic that we deal with, a lot of the patients are not actually able to pay how much we charge, which is $60.
It speaks to the commitment of those who are providing the service because they're doing it because they're meeting a need. They're doing it even though they're being financially stretched to provide it.
Omar says his clinic has asked Ontario for funding, twice.
No response either time.
No. Just for the first time, they said that our requests would be forwarded to the people that make these decisions, and then we never got any follow-up as a result.
In an email, Global News asked Ontario's Ministry of Health for a response to Omar's claims and why clinics like his are excluded from its funding model. A ministry spokesperson replied in a statement, but never answered these questions.
What would happen to abortion access if clinics like yours were forced to shut down?
Oh, it'd be a huge blow. If we were forced to shut down, I cannot imagine where all those patients would go.
If you're in a situation where the clinics can no longer be sustained, you're putting access really in jeopardy.
There are only so many people Omar can help in a system at risk of failure. Jasmine Pisano, Global News, Toronto.